Hi, my name is Caitlin McCarley, and today I'm talking about an article named A New Drug to Treat Muscle Wasting Disease, IBM, that reverses key symptoms in mice and is safe and well tolerated by patients. So first I'd like to describe what this disease is, because if you're like me, you hadn't heard of it before. So IBM stands for Inclusion Body Myositis. This is a progressive neuromuscular degenerative disease, meaning that it gets worse over time and it causes the patients to lose their strength, their muscles begin to atrophy, they become less functional, more independent. So this does affect the entire body, but the main two muscles that begin to atrophy the most are the quads and the forearms. So now that we know a little bit more about this disease, let's get back to the article. So there was a study that was led by the Medical Research Council for Neuromuscular Disease at the University College of London and in Kansas Medical Center that tried a new approach. So they think that patients with IBM, their muscle tissue proteins are misfolded. And so they're trying this new drug, which is called arimoclomol, to be injected into these patients and to see if this drug can either refold the misfolded proteins or if they can completely take out those misfolded proteins and see if that helps with this disease. So at first this was tested in a petri dish in muscle tissues that resembled what they were in IBM patients. And so they tested this on mice. So they injected the drug, and the mice actually showed muscle strengthening in this after getting this drug. So after those promising results, they did a safety trial with 24 patients that do have IBM, and they were given this drug, and they tolerated it well. It had really good results. And so after that, they got a grant for $1.6 million from the United States FDA to do a full-scale clinical trial to continue this research to see if this drug could either stop the progression of this disease or to help regain some muscle strength back for these patients. So the reason why I chose this article was because during my clinical, I actually had a patient with IBM, and so before I started treating him, I wanted to learn more about the disease because I had never heard of it before. So I actually did my own research as soon as I found out about it, and I was able to talk with the patient, and he really informed me with it on his own personal experience. And so I got really close to him, and it really fascinated me how there was no cure, and I really wanted to know more about this disease. So I did this research, and I wanted to see what has changed recently with what they are trying to do for these patients. So I was really excited reading this article to know that they are working on it and they're getting promising results. And I hope they continue, and this drug one day could help these patients that have IBM either regain some muscle strength back or to stop this progression of disease, or possibly one day they could find the cure or even just what the cause is so that they can prevent it. Thank you.